back with more Barnstable This Morning. I'm Sarah Colvin, and joining me live on the phone, I welcome our Chief of Police, Paul MacDonald. Chief, good morning.
Good morning, Sarah.
How are you doing today?
I'm great. How are you?
I'm doing okay. So, Chief, of course, it's really unfortunate that we have to continue talking about this problem, but it seems like it certainly isn't going away anytime soon. Drug overdoses continue to plague our community. Tell me, what is the latest from your perspective?
Well, it's not going away, and actually I think it's getting much worse, and it's important to keep it out there so people are aware of it and they know what's going on out the street. I mean, the biggest thing to prevent this is some type of education and prevention program. With that being said, we calculate it and we track it very carefully, and just so far, year to date, there's been 125 overdoses in the town of Barnstable. That's beginning January 1st until last night at midnight. And with that overdoses, there's been 10 fatalities. And then we break it down even further with that. If you break it down, we have 10 of them were homeless individuals. And then you go back, and if you compare it to 1 year ago at the same time, there were only 45 drug overdoses. So it's gone up substantially. But if we remember when we were tracking it, we talked about it last year, come around end of November and the beginning of December last year, that's when we really saw an increase in the number of overdoses. That's when it skyrocketed. I believe in the month of December of last year, we had almost 30 drug overdoses. So this is continuing to be a huge problem for town of Barnstable, not just for Barnstable. We heard in news reports last week that town of Yarmouth had 3 fatalities last week alone. So this is a problem right across the state.
Absolutely, and I did see that news report in Yarmouth, and you know, the young men and women in their early 30s who did experience those overdoses. It's really unfortunate. So, Chief, I mean, so many factors at play here. Obviously, the strength of the drug, the amount of people using it. But is there anything that we can see, anything we can identify at this point that's contributing to this skyrocketing numbers of overdoses in our community?
It's kind of all over the map. You know, in the old days, you would see relatively young people. Occasionally you see someone in their early 30s to mid 30s, but now you're seeing individuals up into the 50s, up into their 60s, and they too are overdosing, which tells me they're kind of being addicted on the painkillers. They run out of the painkillers and they're moving on to heroin and cocaine. But also some of the some of the product they're buying out there, it's not pure, or it's a combination of heroin and cocaine, or it's being cut with fentanyl, and fentanyl is extremely addictive, and if you take just a small quantity of fentanyl, you will overdose almost immediately. So there is a problem out there. And then we also have to look at Narcan. Narcan was introduced, late December, early January last year, and Narcan certainly is a miracle drug, but is it causing people to take unnecessary chances? Because since Narcan has been introduced, the number of overdoses has grown incredibly.
I think it is, in some instances, Chief, gives people that false sense of security, and anecdotally have heard, out on the street of people saying, oh, we'll have a Narcan party, we'll get this, and then we can get as high as we possibly want, and we're not going to die because we've got this thing that can save us.
That's exactly what they're doing. They're experimenting with taking a larger and larger dose, and they're telling the friends, if I pass out, if I overdose, here is a Narcan, here's what you have to do to bring me back. And these numbers that we have, these are our numbers that we know of. It doesn't necessarily mean all the ones that the fire department has and the hospital has. So these are conservative numbers. So this is really a huge problem for us. And it's hard to wrap your head around it, why people are taking these chances with the life or death risk you're taking here.
Indeed, Chief. And of course, public safety officials such as yourself, the department, the fire department, are really seeing the problem almost by the time it's too late to help these folks. So, if they're overdosing, they've already got the addiction issues. So it's going to take a coordinated community effort. Obviously, I think that all of the stakeholders are having these conversations. But where do you see, or where do you kind of hope that we can maybe beef up this education and prevention?
Well, obviously, the education and prevention have to start at a very young age, and I applaud Gosnell. Gosnell is already reaching out to some of the schools, the middle schools, the high school, the Barnstable. They have counselors in there now, so that's great. The court system, they have to get on board. There has to be some type of rather than going to jail, going into some type of treatment facility. You're providing it for possession only, not for distribution. I know the governor's coming out with a 72-hour program where now we should go to the hospital and they're giving you pain medication that is opiate-based. They're only giving you enough pain medication that will get you through 72 hours. And at the same token, they're trying to give the physicians the capability that if you come in there and you're obviously addicted to some type of opiate, they're going to have the ability for some type of civil commitment to hold you up to 72 hours to detoxify you. So that could go a long way. And I know some of the state legislators that work on the protective custody statute because this is a huge problem for us. We administer Narcan. The person somewhat recovers, regains consciousness. As soon as he does, he has the ability just to walk away, which is a huge problem because it's just because he's regained his consciousness now. The heroin, the cocaine is still in the system, and you could very well overdose again, and we're not going to be around. So we're trying to get the law passed, so anybody who does overdose or they are administered Narcan, they have to be transported to a hospital, at least for observation for at least a 6 to 8 hour period, just to make sure they have detox and the cocaine and the heroin is out of their system. So there are a number of changes that have to be taking place because 11 fatalities in the first 10 months, that's unacceptable.
It really is. And Chief, this is something that affects all parts of our community, all parts of our society. I think that you mentioned earlier that the number of fatalities is mostly amongst the homeless community, but I think when we look at the 125 overdoses, it really does range in station in life, socioeconomic status. Would that be a safe assumption for me to make?
Absolutely. The only difference is the homeless population, if they're overdosed, if they're out in the camps, there's no way to get to them. There's no way for them to call for emergency services. Other people who have the wherewithal, have the resources, they're in a home, they're with their friends, they have a cell phone, they can call, and we can respond with the fire department immediately. So the homeless people, they do have those additional challenges because they are out in the woods, and it's pretty much inaccessible out there.
Does this, Chief, put additional pressure on the department to try and go after the folks who are bringing the heroin and perhaps the fentanyl-laced heroin into our community? We
have two major cases going on right now, and I can't discuss them, but we are working closely with the federal agencies and the state agencies. Two significant cases that we believe two substantial distributors who are bringing the quantity of the heroin and the fentanyl and the cocaine down to the Cape, not just to Barnstable, but down to Barnstable County. It's hopefully it'll be a major investigation, but these type of investigations, any type of narcotics investigation, it takes a lot of time because there's a lot of surveillance involved in these type of investigations.
Absolutely, and you want to make sure you have all your ducks in a line when you get to the end of that investigation.
Because when it gets to the end, it's just not enough to probable cause. We have to make sure we have the evidence to get a conviction in court, 6, 9 months, 12 months down the line.
Indeed. Well, Chief, we certainly thank you for your attention to that matter. Looking back over the past week, in terms of police action, how's it been here in the town of Barnstable?
It's been relatively quiet. We've had a cold snap of winter come in, and we've talked before. And we always tell you, a good cold night it keeps everybody in the house and keeps everybody out the streets. And we have a very slow period right now, so that's good for us. Gives us the opportunity to catch up on a lot of other different things that we've been neglecting.
Absolutely. Well, Chief, I thank you so much as always for joining us here on Barnstable This Morning. A pleasure to have you on the program. And we will catch up with you again next week. Have a great day.
Talk to you then.
Thanks much.
Bye-bye.
Bye-bye. Chief of Police Paul MacDonald joining us here on Barnstable This Morning. Our community profile segment is next, but first...